Please show your hand to choose a language. Welcome. During doffing, take your time and do not touch your face. Done. Preparation. Open the door to leave the patient's room. Removal of PPE must be done with a buddy. Do not exit into clean zone wearing PPE. Inform the buddy about any breach or high exposure before removing PPE. Done. In the next step, you will remove your apron. Do it by pulling forward from the front to break the neck and waist strings. Slowly remove your apron. Done. Remove first layer of gloves. Show your hands when finished. Done. Slowly remove your gown and gloves together. Touch only the inside part of the gown. Roll it away from you and place in clinical waste bin. Done. Without touching the contaminated surface, remove face shield. Place in clinical waste bin. Done. Remove cape hood. Done. Remove gloves without touching the outside. Place in clinical waste bin. Show your hands when finished. Please keep showing your hands, checking gloves. Done. Perform hand hygiene. Remove mask touching only the straps. Place in clinical waste bin. Done. Boot removal. Step out of the boot and into the clean zone. Pinch the inner surface of boots together and place into the bin. Perform hand hygiene using soap and water. Done. You're all set. Thank you.